Good afternoon and welcome to Ask an Expert with Lacey Giunta. Lacey will be sharing her expertise this afternoon. Her role is to support families through ChildServe, and some of her expertise is helping families navigate through the complicated waters of all the waivers. And so Lacey this afternoon will be talking about HIPP, health insurance premium payment. So Lacey, I'm going to turn it over to you. Thank you again for sharing with families so that they can have this support as they unravel this complicated information. So thank you, Lacey.
Wonderful. Thank you, Deb, and thanks, Erin and Alicia. As Deb said, I'm Lacey Giunta from ChildServe Case Management. And I know it's Ask an Expert, but the experts are really this DHS program is not a ChildServe program. It's just that I help a lot of families navigate and apply for the program if they're eligible. And so I'll have the contact information for the HIPP office because they are really the ones managing it and the ones who I don't review the applications or anything. They're the ones who do all of that fine work. But if you have questions or wondering if you should apply or wondering if it makes sense for your family, I can definitely answer those questions. So what is HIPP? So HIPP is, like I said, the Health Insurance Premium Payment Program. And really what it's designed to do is save money for the state. So it's only for those who have access to both private health insurance and have access to Medicaid. What the program does is it determines if it's cost effective to pay a portion of your health insurance premium. For an example, so I work at ChildServe, so we work a lot with families who have younger children or families who have young adults. If you have access to private health insurance and you have maybe one child in your family also has a special health care need and is on a waiver, that child then has access to Medicaid. So you still have this family plan probably through your employer, and then you also have access to Medicaid for the individual that you're supporting, then HIPP might be a good fit for you because it can help pay for the premiums to keep that child on private health insurance. The reason why the state would do that is to incentivize you to keep your private health insurance, because one option that families have if their child is on Medicaid is to say, oh, they're covered under Medicaid. We don't need to pay their private health insurance anymore. Everything should be covered under Medicaid. So they could drop their private health coverage, which in turn could cost the state more money if more Medicaid fees are being paid rather than the private insurance picking up the cost of that. If we're looking at who's eligible, first thing that they have to do is they have to determine that it's cost effective. And how the HIPP office does that is they have this formula that they use. I don't have access to the specific formula, but really what they're doing is they're looking at that specific individual's premium cost. And so if it's a child and they're on a family plan, they would look at what's the cost for that one specific person who's also on Medicaid in relation to the whole family premium. They also look at what the private health insurance covers. If your private health coverage is pretty comprehensive and they cover a lot and premium cost is manageable, then they're going to look at, does it make sense for us to incentivize this person to keep their private insurance by paying you back a portion of your premium to keep that coverage? Because in the end, that's going to save Medicaid money if your private health insurance is covering a lot of what Medicaid would be covering if you didn't have it. How they determine cost effectiveness is how they're going to look at that the state pays for all individuals on Medicaid. Anyways, family is assigned to a managed care organization. Right now in Iowa, we have Iowa Total Care and AmeriGroup. If they're assigned to one of those managed care organizations, the state is paying a per member per month amount for that managed care organization to manage the Medicaid. And so they have to look at, does it make sense? Does it save us money to not pay that fee and pay the premium portion instead? So what we know is that for families who are paying premiums for health insurance, a lot of times those premiums can be expensive, especially if you're on a family plan or if you have a plan that has a lot of coverage and is an expensive plan. even if you have a family of 10 and only one person's on Medicaid, they can still pay a portion of that premium for that one individual that's also on Medicaid. And so what that looks like is an incentive check, basically to say, we want you to keep using your private insurance for this individual. How they do that is private insurance is billed first and Medicaid is billed second. So if you're going to a medical appointment or going to a therapy appointment or going to the pharmacy is going to look at your private insurance. I'm throwing out one, let's say it's Blue Cross Blue Shield, and they're going to bill that first. Medicaid gets the benefits of getting that reduced bill because they're the second payer. So if Blue Cross Blue Shield is covering 50% of the cost, then Medicaid typically would cover 100% of the cost. And so that's a 50% cost savings for them. So they're saying for those they approve for HIPP, they're saying they want you to stay on private insurance because it saves Medicaid money. One of the interesting benefits of HIPP is also that you are assigned to a Medicaid fee-for-service population and exempt from Medicaid managed care. It's kind of a unique small population of people who are on HIPP, and those people are in fee-for-service population. And so fee-for-service is the technical name for old Medicaid or traditional Medicaid or straight Medicaid. The idea that it doesn't go through the MCO, it's the old way of doing things before Medicaid was privatized in Iowa. So you still have access to the same network of providers, the same network of doctors, all of that. The difference is that it's straight Medicaid, it's typical old Medicaid, and not your AmeriGroup or your Iowa Total Care that your Medicaid is going through. How that benefits the families that ChildServe Case Management serves is that all of the families that we serve in our case management program specifically, for those who are on waivers, are in the fee-for-service population. So MCOs manage all of the case management for the individuals who aren't fee-for-service. And so if you are fee-for-service, then you're in the old system. And so you have access to potentially a region or a county or DHS for your case management, depending on how that looks, or an agency, depending on how that looks in the area of the state that you're in. When we look at reasons why people would apply, if they have private insurance and they have Medicaid and they're saying, wow, this sounds like something that we should apply for, some of the breaks in the chain are some of these ineligible plans. So a lot of employers are going to high deductible plans. I would still recommend that everybody always apply so they can do the formula for you, determine if it is cost effective or not. But a lot of high deductible plans are ineligible. And the reason being is that if your plan is a high deductible plan, it's covering a smaller amount of services. And so Medicaid's picking up a bigger portion of services, so it might not be cost effective. Also, subsidized insurance plans. So if you have access to private health insurance that's subsidized, so you're not paying a premium, there's no premium payment of the HIPP program if there's no premium to pay. So if your premiums don't cost anything out of your paycheck, let's say if you're getting it through your employer, then there's no incentive, there's no reimbursement for those premiums. And so those plans are ineligible. Also, temporary plans, so plans that are really limited coverage, don't typically get passed through and approved for the HIPP program. And then we also see, so kids who are on Medicaid for kids with special needs, and that's a Medicaid program who provides coverage to kids who have a special health care need but don't meet the income guidelines for traditional Medicaid. They have a slightly raised income guidelines for MKSN, Medicaid for kids with special needs, but those plans are not HIPP eligible either. And then Medicare, so at ChildServe, this comes up frequently for the adults that we serve, where once you're 18 and you're considered an adult, maybe down the road, you're getting your health coverage through your parents. And if a parent were to retire or were to pass away, then after 24 months, you become Medicare eligible. And if you've got Medicare and Medicaid, there's not a lot of incentive to also pay for your private insurance because you've already got a lot of coverage already. This is an inclusive list. There's more reasons to deny a HIPP application. These are just the ones that I see commonly when working with families to try to link them to the HIPP program. I always recommend people apply. It's a one-page application to get started. This application basically signals to DHS, hey, I'm interested in the HIPP program. Then there's some document gathering that follows. If you're watching this and thinking, oh, we might be eligible for that HIPP program, I would just encourage you to fill this out, send it off, and then they'll contact you to get the additional information. So this is just the get your foot in the door to get started. And it's a quick and easy form to fill out to kind of check that off your list of the million things I'm sure families have to do. And then they'll come back to ask for all of these additional documentation pieces that can require some gathering. So they're going to want to know what the insurance that you have, what's it cover? What are the benefits? What are the options? And they're also going to want to see what do you pay for that plan. So they're going to want to see what's deducted for that premium payment. And then they're going to want proof that you are covered by the insurance. So your insurance cards. And then they could do a look back. So they can determine cost effectiveness based on the claims that have been paid. So up to 12 months in the past, they can look and say, this kiddo, and I always say kiddo, but the person you're supporting maybe has a lot of healthcare claims and the private insurance is covering a lot of those. So wow, this is really cost effective for us to have them keep their private insurance. Or it could be you have a kiddo that's eligible for Medicaid, but maybe is pretty healthy and doesn't go to the doctor very often, and they don't have a lot of healthcare costs. And so that weighs into, is it cost effective or not? And a tip for the trade is when the HIPP office is looking at claims that have been paid, they often look at the medical visits. So those therapy visits, the specialists, the preventative care, the pediatrician, the doctors, all of that. When families feel like, oh, we feel like we really should be covered by the HIPP program, but we got denied, sometimes having them pull up pharmacy records and pharmacy claims is a way to have them relook at the eligibility, because that's not an auto thing that they pull. But some of those medications that people we support are on are very expensive, and private insurance or your prescription coverage may be covering a lot of those pharmaceuticals. And it may be that you rarely have to go to the doctor, but your monthly pharmaceutical bill, private insurance is covering a big chunk of that. And so it might be another reason to say that HIPP should be approved, because your private insurance is saving Medicaid a lot of money on the pharmaceutical side. So it doesn't work for everybody, and it's all based, the formula is very individualized. So it's really based on the person you're supporting and what their health coverage looks like from an insurance standpoint and what it looks like from the claims that they've accrued in the last year. And there are some additional ways to look at that. So here's a form where maybe your private insurance is brand new, so you don't have a lot of claims to go back and look on, or Medicaid is brand new, so they don't have a lot to go on of, or maybe your kiddo is brand new if it's a young individual, or maybe their condition is brand new. So if you don't have that history to pull from, this form, they may request it, or you could provide it, that just shows some of the DHS determine lists that require a lot of treatment that may accrue some claims on your private health or Medicaid. And then you've got the other category. So if you have a kiddo who maybe last year they didn't have a lot of conditions or claims or specialists, but this year you're like, you already know that we've got appointments scheduled, we've got specialists, we've got things coming down the pipeline that my private insurance is going to help with, or that's going to be very expensive for Medicaid to cover, then this would be a good way to track that or report that back as part of your application. So, a lot of times what we see is kids who, have big surgeries coming up that are going to be very expensive, and they know what their private insurance is going to cover and Medicaid will cover the rest. Or if maybe they've been on a waiting list for some therapy services for a long time, and their private insurance is going to cover several of those visits, and they're finally eligible to finally get that, then you can let them know, yep, we've been on a waiting list for physical therapy for a year now, and now we're finally getting that, and our private insurance is going to help cover 20 visits or whatever it is, and they can calculate the cost savings to Medicaid based on that. So this is just a supplemental form. That one's not required, but sometimes it's helpful to think of, well, maybe I didn't have a lot of claims in the past 12 months when we were looking at, is this cost effective based on last year? But this year our claims are going to be higher. This is a way to show that or provide that information to the HIPP office. And I can get copies of that form available. You can get it from Ask, or you can get it straight from me as well. For people who dig a little deeper and want to know the rules or really want to dive in, this is where it is in the Iowa Administrative Code about the HIPP program that gives you the definitions, and it gives you more information of how it's looked at from a very objective standpoint. So if it doesn't make sense of why you got approved and you want to dig in deeper, I'm all about the policy and I want to know the why. And so I've just shown you where you can find it in Iowa Administrative Code. You can just look it up. So 441 is the Health and Human Services section, and it's in Chapter 75. So that's just available for those who want to dig deeper and want a little bit more information. So when you fill out those forms or you're providing all that information to see if you're HIPP eligible, this is the HIPP office where it goes. You can email it, which is a wonderful new addition. You can fax it in, you can mail it in, all of that. They also have a great staff over at the HIPP office. So if you have questions we've even had families who have their open enrollment coming up and they're like, ooh, we're wondering, we want to continue on the HIPP program. We're wondering if this insurance plan is cost effective or not. They can talk through that with you. They don't necessarily want to do it with anybody other than the actual family who's applying for HIPP, but they can help answer some of those questions. So they're a great resource. They're the one who does the formula. They're the ones who determine cost effectiveness. Also, if you have a change in your health insurance, so either you're switching jobs or you've lost health insurance or you're on a new plan or you switched it to your partner's health insurance or whatever situation is, those things are reported back to HIPP also. And so that would be where you would reach out and say, by the way, we've got a new plan, and they have to run the formula again if things have changed to determine the cost effectiveness. For those who just want to go out there and grab that information, you can just Google Iowa DHS, and then in the search box, you can just put HIPP, HIPP, and that's the web link to get you to that program, where it has basically the same overview in writing that I'm sharing with you on this webinar today. And then the application is also available on that site. So it's a PDF. You can print it off at home. You can fill it out online. You can email it in. However, it works best for you. It always confirm that they receive it. I say that about every form you send off with your child's or the person you're supporting's information on it is always confirmed that it's been received. And then once it's been received, it's usually a pretty quick turnaround to get the answer of is it approved? Do they need more information or is it denied? So I will say it can be a lot of document gathering initially to get approved. And then if things stay steady, you continue to be eligible for private health insurance and Medicaid, then it's pretty hands off for a while after that, unless you have any changes. We'll say that one of the benefits to this program is that a lot of families are able to keep their private insurance, and that gives them access to maybe doctors and providers who don't accept Medicaid only. If you're in the situation where you have access to private health insurance, sometimes it's beneficial to keep it. And so I'd always recommend applying for HIPP to see if you have it. Sometimes it's more limited if you have Medicaid only than if you have private insurance, in addition to your Medicaid, on who you can see from a specialist standpoint. So it may give you more options depending on your situation. That's not the same for everybody, but there's just the caveat because families do have the option to say, oh, now my kid is covered, or the person I'm supporting is covered by Medicaid. We don't need the private insurance anymore. And so this is just a way to support that and to give you a little bit more choice in your providers if you do have access to that. And it is a very small amount of people who have access to private insurance and Medicaid. So it's a small number of people in the state that are under this system. And so it's not always second nature for providers, doctors, pharmacies to know to bill two insurances, traditional Medicaid and a private insurance. But once that information's out there that you have both of those, once it's set, you're good to go. So if there are any questions, I can answer those. Otherwise, the HIPP office is a great resource, or I'm always available. You can email me, call me. I can't answer whether or not your health insurance is cost effective for the state or not. That's a HIPP office question. But if you're wondering, should I apply, or does this make sense for our family or our situation, or what really would be the benefits? How would it look for my specific person that I'm supporting? I can walk you through and help to answer those questions. And so that's my contact information there. And I'll share that out with Ask. So if you're watching this webinar and have that question down the road, you can always reach out to me. I don't plan on going anywhere.
So Lacey, thank you. Very, very
Yeah.
helpful. What I hear you say is don't give up and at least try.
Right.
So we do
Yeah.
have some questions. Rhonda asked, could you explain the benefit of HIPP when it comes to exempt from Medicaid managed care? And then she also asked, would you recommend any family just going ahead and applying if they aren't sure if they would qualify? Is there an annual process to see if your child still qualifies? Thanks, Rhonda, for those questions.
Yep. So I'll answer the second one because it's a quick answer. The second question, is there a process to stay eligible? And yep, HIPP office looks at it annually. Or if you would have a change in your insurance, they'll take a look at it then too. So I would always recommend to apply, and then annually they look for the cost effectiveness again. So that's where we've come up with situations where families who are maybe have been on it, but maybe it's been a healthy, quiet year and they haven't had a lot of claims on their health insurance. And so HIPP office is saying, I don't know if it makes sense to keep this incentive going, keep doing the premium payment. And then you can state your case for either, well, we've got this coming up, or we know that we have these claims coming, or we have this surgery scheduled, or it was a lucky, wonderful year where we didn't have much, but that's not a typical year for us. And you can kind of explain that. And the HIPP office will look at that eligibility, and they look at it all on an individual basis. And so I always just recommend just having a conversation with the HIPP office. Most of them are women over there, and they're very nice to work with, and they deal with these questions all the time. So the ones that we're used to working with, families can call and say, what do you think about this situation? Or this is where we're at, or this is the situation we're in, and they can take a look at it on an individual basis. But yes, it is looked at annually. So once you get on HIPP, it doesn't mean you're on HIPP indefinitely. And just because you're denied HIPP doesn't mean you're never going to be able to reapply. To her first question about managed care, for those families who were on Medicaid prior to Medicaid privatization, that's what fee-for-service Medicaid looked like. It was the pre-MCO. Everybody had straight Medicaid then. And now we have two populations. We have managed care, and then we have fee-for-service. There's pros and cons to both of the programs. So with fee-for-service, you don't have the extra benefits that the managed care organizations can offer, but sometimes you have more choice in some of your providers if you're on the fee-for-service side. It doesn't change your waiver, it doesn't change your access. It basically, you would switch over from state Medicaid, what they call it state plan Medicaid, instead of managed care Medicaid. So if your child is on a waiver, instead of working with a managed care company for your waiver planning and care planning, you might work with DHS or your region or your county or your local case management agency outside of the managed care organization. So hopefully that answered your question, Rhonda.
Great. Rhonda, if that didn't, feel free to put it in chat or question and answer again if you need more clarification. Okay, we've got a couple more questions.
Sure.
Can you explain how often a family has to apply for HIPP? And once on HIPP, does the family have a case manager, similar to families who have case manager for MCO? If you feel like we need to expand on that, we can.
Anytime you have a change in insurance, it goes back through the formula. So if you're newly applying for HIPP, they'll run the formula. If you have a change in insurance, they'll run the formula. If you lose your private insurance, they'll run the formula. And so I think the biggest thing is if things are staying the same as far as all your claims and your private health insurance and your Medicaid eligibility, then your coverage should stay the same under the HIPP program. However, if your claims change or your insurance eligibility changes, then they're going to take another look at that. And at minimum, they look at it annually. But if you have changes in there as far as, unfortunately, somebody loses their job and lose private insurance, or they're switching jobs and their coverage at their new job is different than what they had before, they have to run that formula again. And with case management, I don't want to go into too much specifics because this isn't about ChildServe Case Management, but I can't answer any of those questions. But the families that we serve in case management outside of MCOs, and when I say we, I mean all of the counties, the DHS, the regions, the ChildServe, the Link Associates, the families that we serve that are outside of managed care are in the fee-for-service population. If you are in a managed care population and you have a case manager, your case manager would be from your managed care organization. If you're in the fee-for-service population, you have oftentimes a choice of case management providers depending on your waiver and what's available to you. And so it does look a little bit different, but depending on the waiver and depending on where you want your case management from, it's hard to go into specifics of what all is available for families. If you want to talk to me about your specific situation, you can call me or email me and I can talk through that of what that might look like as far as what it looks like in your region or based on your waiver, what your choices are if you were to be assigned to the fee-for-service population.
Right. The question was about if you're on HIPP, if you have a case manager, and it sounds like yes, but you have some choices in there of how you navigate that is what I'm hearing you say.
So HIPP alone doesn't mean that you have a case manager, but a lot of kids who would be eligible for HIPP are on a waiver because it might be that that's how they get their Medicaid, but also have private insurance. So if you are a family who is eligible for Medicaid based on economic status of your family, there's a good chance that you probably don't have access to private health insurance. If the individual you're supporting has a waiver, then you have that Medicaid and maybe private health insurance. So it is a small population of people who have both private health insurance and Medicaid. And a lot of times it's because they have a waiver. And if they have a waiver, there's a good chance they have a case manager. So it's kind of a trickle effect of how that all works together. So HIPP alone doesn't mean you have a case manager, but oftentimes a lot of our HIPP kids are also on a waiver. And so then they would
Gotcha.
access the case manager.
Okay. So it's more of a circle, that how the circle connects is
Right.
the way I'm understanding it. Okay. Lacey, sharing your insight, and what I heard you encourage is to go ahead and apply and use the service of the folks that are there because they have a lot of expertise. You can also share your expertise available. And again, thank you for sharing, for Ask an Expert and helping families. So thank you, Lacey.
Yeah, everybody, thanks for watching, and thanks to Ask for providing this service to families so they have access to more information. I appreciate it.